Great strides have been made in understanding asthma. The medical field now agrees that asthma is a disorder characterized by twitchy airways, known as hyperreactivity, and inflammation in the lungs. There are different types of drugs used to treat these two characteristics of the disease. By focusing on the underlying inflammation, you can better control the symptoms to reduce the occurrence of asthma attacks. Inflammation is a response that normally occurs when your body needs to fight a disease or a disturbance to its natural balance. Asthma, allergies, cold, stress, or exercise can all cause inflammation. Inflammation can also be the result when you breathe in cigarette smoke or have a viral infection. You probably know the feeling of an asthma attack, the tightness in the chest, the feeling that you can't breathe, or perhaps even wheeze when you breathe. But do you know what's actually happening inside your lungs? In people with asthma, the inflammatory response is exaggerated and many different kinds of cells are involved. These cells go through a complex set of activities to release chemicals. The chemicals are what cause the symptoms of an asthma attack. If this happens on a regular basis, your lungs may be damaged. Although you may always have asthma, there are treatments that can minimize and control the occurrence and alleviate the symptoms of an asthma attack. In fact, the inflammatory cells and chemicals in your lungs can be controlled when you use an inhaled corticosteroid, ICS, the most common treatment for asthma. This medication is usually delivered to the cells in your lungs through an inhaler. Let's have a closer look at how an ICS works. When you are having an asthma attack, chemicals released from inflammatory cells in your lungs cause excess fluid to leak from blood vessels in the lungs, tightening of the muscles surrounding the airways, and an overproduction of mucus. When you inhale the ICS, the drug travels through the airways and is recognized by the inflammatory cells in your lungs. When the drug interacts with the cells stop their production of the active chemicals causing inflammation. Thus, the ICS is able to reduce the occurrence of asthma attacks by stopping the inflammatory process, resulting in a decrease in the fluid and mucus buildup in the lungs and better control of your asthma. Even though ICSs are an effective maintenance treatment for asthma, as with all drugs, including placebo, there may be side effects associated with your medication. Please talk to your doctor about these and other potential side effects. You may also use a bronchodilator to relieve symptoms during an asthma attack. These drugs are known as rescue drugs as they begin to work immediately. Bronchodilators work by relaxing the muscles around the airways, resulting in an increase in airflow. Beta agonists and anticholinergics are two commonly used bronchodilators. Usually, the medicine is delivered into the lungs through an inhaler, but can also be prescribed as pills or liquid or given as an injection. There are side effects associated with bronchodilators. Please talk to your doctor about these and other potential side effects.